Lovely. Thank you very much, Kasim, and thank you to board for inviting me to come and speak. I know many of you in the audience. It's nice to see you all. Okay, so 15 minutes on research in pseudo obstruction. I think, like many of you, I spent most of my life at this bus stop waiting for research to come along in pseudo obstruction, and it is pretty miserable because we want there to be progress, we want there to be movement in terms of moving things forward. I mean, there is good news, and the good news is that there is a bus, and I put Kasim in the... but there are lots of people that are focused on this very, very challenging, devastating condition that are working across the world. And I think what we have seen is a very positive move, is that these groups are now beginning to come together to try and address this condition. Now, it's impossible for me to talk about the work of all of these individuals, but I just wanted to pick up a few things. I was pleased to see that already we've started to talk about some of the areas of research, and I will try and cover some of those. So Nigel already talked about the fact that the majority of pseudo-obstruction that we see in children is going to be congenital. We're going to see presentation within the first month of life in about 70%, and almost always in the first year of life. We've also talked about the fact that this is supported because if we look prenatally, we can possibly identify about 20% of the children who have a dilated urinary tract, especially when it comes to late gestation. So therefore, there's a whole bunch of research which is now trying to look at the development of the gut, of the nerves and the muscles within the gut. So this is a picture of a developing embryo. Sorry, I'll try and get this picture. And gut development starts actually very early on in life. It starts even within the first trimester, within the first few weeks. You develop a gut tube, and if you're looking at the nervous system of the gut, or what we call the ENS, or the enteric nervous system, that these cells will start to do this long journey which starts from the top end of the gut right down to the lower end of the gut. If they don't complete that journey, it's known as Hirschsprung's disease, and that's a condition that Nigel mentioned before. They're pretty groovy cells, and this is a video which is showing migration of these cells, and also people have labeled some of the cells as they move down. So here we can actually see these cells doing this amazing migration down the gut tube to start to colonize it, to form this really complex nervous system of the gut. And that nervous system, I've mentioned already, is this enteric nervous system. So this is a loop of gut showing staining of all the nerves, and you can see it's just like an amazing lace-like network. Now, if we start to look at all of the factors that are involved in making this nervous system of the gut, it starts to get very daunting, because we start to say, if we look at gut environmental factors, here's a list of those, here's a list of cell signaling pathways, here's a list of transcription factors and intracellular molecules. And in April of this year, the guys who do a lot of research met in Rotterdam, and so there's a whole conference dedicated to trying to look at the development of the enteric nervous system. And what I wanted to just update you is a couple of things which have come to light. Now, we all know about spina bifida and the supplementation with folate to try and prevent a spina bifida. Now, one of the things that people have done is to try and look at the nervous system and see whether there's any relationship to diet, for example. Now, what I'm going to tell you is just research. It does not have any implications. So don't go home and start piling any vitamins down you, because we don't know whether this is strictly true. So one of the studies came from Bob Hercroft's group, and this is a group based in the United States, and they looked at a whole variety of things. And one of the things they were looking at is folate and other vitamins, and what they found is that if they depleted vitamin A, these are all in animal studies, if they depleted vitamin A, then the nervous system of the bowel failed to form completely normally. In fact, a lot of these mice had Hirschsprung's disease, so they actually failed to form their enteric nervous system. So now there's a whole bunch of studies looking at, because one of the questions I get asked all the time is that, could it be something that I took in pregnancy that has influenced whether my child develops pseudo-obstruction? And the answer at this moment, we don't know. So therefore, there's a whole bunch of studies trying to look at influences within pregnancy. And more often than not, it's not going to be one thing, it's going to be many things coming together. And so far, we don't have any answers in that respect. But research is beginning to push itself towards that. Then this study, we've already talked about extracellular proteins. There was a study looking again at the formation of the nervous system of the gut. And in this group, they found that as these little cells were migrating down and making the nervous system, they were changing the environment, they were changing the connective tissue. So we know that there's a very close relationship between the nerves in the gut and the environment that they sit in. And of course, we've talked about this fact that we now recognize, largely through the excellent work that Kasim and his group have done here, that we have a whole bunch of children and adults where there are connective tissue disorders or hypermobility in this group of children that have dysmotility, pseudo-obstruction. But very importantly in this group is that they have a lot of issues around pain as well. So pain is a really fundamental problem within this group of connective tissue disorders. Now what's amazing is that if we actually think about the gut and we see how beautifully it moves things along, and then we actually look at the nervous system, it looks like a complete crazy paving system, and how possibly can it start to move things down the gut in a very ordered fashion. All right, so if you take a segment of gut and you put a little pellet in it, completely separate, it can amazingly just pass this pellet by itself. So it's a very, very well organized and coordinated system. So there was a group in London that said that we don't buy the fact that this enteric nervous system looks so disorganized and yet it can do such amazing work. So what they went out to do, and this is real painstaking, is that they started to label each of the cells to see what were the fibers that they were sending out down the gut. Because they were saying that there must be some organization, these fibers must be heading in one direction. And indeed what they found is that if they labeled individual nerve cells within the gut, they all sent their fibers down in one direction. So this is just a accumulation of all of those fibers, and you can see they're all heading down in one direction. And you can see that in this video, again, of development of the enteric nervous system, where you can see the cells, actually the red cell, moving down in one direction, sending its fiber down in one direction. So very careful organization. So this group then said, well, maybe this will help us identify new genes in pseudo-obstruction. So we know there's a group of genes, so if I'll ask all of you to partake in this. If you look at the hairs on your arm, you'll see that the hairs are all organized down in one path, all right? Our hair sits in one direction, okay? And if you look here, if you look across your body, there's organization. And these genes are called, in the fancy name, are planar cell polarity genes. And they dictate how things should go in a nice, organized fashion. And we can see this, so they actually, if you look at a fruit fly, we see that on the wings of the fruit fly, there's this organization. If you affect these genes, you get this complete disorganized pattern. The same with the fur on the paw. If you affect these genes, you start to see that there's this disorganization within these hairs. They did the same within the gut, and now instead of having a gut where there is a nice fibers heading in one direction, they were basically just running in all directions. And what they found is that these mice had pseudo-obstruction. So they actually now had a model of pseudo-obstruction. So instead of having nice organized contractions, these mice had a very disorganized contraction. So here's the pellet in a normal situation being passed down gradually down the gut, whereas in this situation it doesn't really go anywhere, it goes up and down, mimicking exactly what you would expect to see within pseudo-obstruction itself. But the challenge here is that if you look at the gut itself, and if you look at the histology, so if you look under the microscope, you never notice anything. So they got a number of people to actually look at the organization of the gut, and under the microscope they could see no difference in this gut whatsoever by actually looking, even with specialized stains. And that goes to show that that's the challenge we face when we're taking biopsies. And through Charlie Knowles' work here, we know that about up to 20% of biopsies will come back normal. So we know that the children have pseudo-obstruction, we know that there's changes within the bowel, but we will not be able to see anything. And as we've gained experience, we know that this can be even as high as 40%. So a normal histology may not tell us. So therefore, it's really pleasing to see that one of the big areas of research is, which is led by Charlie Knowles, based here, is to say that we need to be better at looking at histology of the gut. So a lot of the research is now being directed to start to be better at identifying exactly what the problem is and what it might mean for individuals suffering from pseudo-obstruction. So what about genetics? So this is a list of all of the genes that are recognized in pseudo-obstruction to this point in time. It's a tiny list. If you think about the number of individuals that have pseudo-obstruction, this is literally a handful of cases. So we're probably going to be talking about less than 50 cases worldwide where we've actually identified a gene for pseudo-obstruction. And the other thing it underlies is that this is a complete heterogeneous mix of conditions that all end up with this problem of pseudo-obstruction. So pseudo-obstruction is almost like a symptom. It's a symptom that we're describing. It's not a disease, and yet we talk about it as a disease. And hopefully what will happen in time is that we will start to separate all of these out, because we know that this is not the situation. All right? If you look at a service of pseudo-obstruction, this is not what you see. Everybody's kind of the same, but then there's one individual may be different. We actually see that now. We've been running the national service at Great Ormond Street for 3 years, and almost every single child is different from the other child in that service. How are you supposed to make any progress in terms of research in that scenario? So the way around it is to actually develop national, international collaborations where you're saying, I want every known case of pseudo-obstruction to enter into a database where we collect this information, we can compare all of these individuals. Only then can you start to see patterns. And only then may somebody say, actually, I've got a patient like this is what I did, this seemed to work, and then you might make progress. So a lot needs to happen in that respect. And this was just to illustrate the point. You can't really see down here that one of the papers that got published previously from us, it took 25 years to get 44 patients to actually describe them, and then they were all different. So then that just underlies the challenge there. Okay, so one of the other research areas is going to be in diagnostics, to start to come back to this question of how can we better define disease in children. I'm sure many of you are familiar or have had to endure manometries many times over. And for those of you who are not used to them, a catheter is placed into the small bowel, and then we can get a contractile reading from the bowel. So this is a normal small bowel manometry, and we can actually see that this wave of contraction is passing down in a nice organized fashion, as we can see from this arrow. If you have neuropathic pseudo-obstruction, you lose that normal progression and you end up with the arrow kind of doing a bit like this. And that's what the food would do, and that's what the contents would do, not really go anywhere. In a myopathic pseudo-obstruction, you can actually see that there are some waves moving down, but you can barely see them. So the actual force of the contraction is so low within that. And this is a real, in pediatrics, I have to say, we use it as a very, very valuable tool to look at the diagnosis of pseudo-obstruction. And thankfully, there's been so much progress in this area. So now we've moved on to what we call high-resolution manometry. So in the old catheters, we would stick down a tube and it had 3 recording ports, and that's all we'd actually see, is 3 of them. But now we've actually moved on to recorders that can measure masses and masses of information that come up. And why is that valuable? So here's a catheter in place, and this is from work which is done both in Australia with Phil Dinning and Mark Scott, who's based here. So this is a catheter which got absolutely hundreds of ports sitting within the gut. Now in the old days we would get a reading like this, so you can see that these are actual contractions within the gut, and if you look at it you might say, well, actually it's not so bad, because we can actually see that within this gut there's some contractions which are going down. But part of the problem was we were then trying to make clinical decisions, and we sometimes wondered whether instead of going that way, maybe they were going that way, which would be completely abnormal. By increasing the number of ports, you can actually now start to see for definite what you're beginning to see within the bowel, to know whether it's normal or abnormal. And if you convert these kind of mountains of pressure, you end up with a high resolution plot, and you can see this now nice and clear. And this is really one of the big advances in research now. What I showed you was in the colon, in the large bowel. So now there's the development of these catheters within the small bowel itself. And John Arkwright, who's based in Australia, shared this data. They presented this at DDW, which is a big gastroenterology meeting in the States this year, showing that we can now start to get some really important information from the small intestine about its function. And I think this is absolutely critical as we start to apply these tests and understand what kind of pseudo-obstruction we're dealing with. And in fact, there's been some work which we did which looked at colonic high-resolution manometry, and we could actually identify those kids we would expect to see a problem on histology when we looked under the microscope. So maybe in the future we may not need to resort to full thickness biopsies. We may be able to do this high resolution plots and get a good idea of what we expect to see. What about treatment? We've talked a lot about treatment. I'm not going to cover it, and that's been possibly the more miserable side of pseudo-obstruction, is that we're not really good at managing it. We manage to control some of the symptoms, but we're not really curing these conditions. So one of the pushes is to try and develop curative treatments if we can start to understand what is happening in the disease. One of the approaches we did was to say, well, okay, we know that the nerves are abnormal in this. What about if we could transplant some stem cells, nerve stem cells, to regrow normal functioning nerves within the bowel? So a long while ago, it always seems like yesterday, but it was about 15 years ago, we started to do this. And as time progressed, we could actually identify nerve cells present within the gut itself. So all of us within this room have nerve cells which constantly repair the nerves within the gut every day. We get a gastroenteritis, we may develop other illnesses which actually damage those nerves, and we have the capacity to repair them. When you are a child, you have a better capacity to repair them than normal. And what we found is that we can actually do fairly straightforward things like an endoscopy. So we just did an upper GI endoscopy or a colonoscopy. We could take little biopsies of the lining of the bowel, and then we could grow nerve stem cells from within the lab. We can actually grow these nerve stem cells within the lab. So what we've done more recently over the last few years is take these stem cells. If we were to transplant them into an experimental model, we'll never find them again because there's billions of cells in there. So we mark them with a green fluorescent marker so we can always see them. And you can see these balls of stem cells which are now fluorescent green. We can then inject them into models of pseudo-obstruction. Okay, so remember I talked about this, that the Vasilis Paknis' group had got these mice and they generated them. We worked with another mouse which is deficient in a particular neurotransmitter which appears very important in gut disease called nitric oxide synthase. And we injected these stem cells. So again, these are mice in which if you just looked at the nervous system, you wouldn't be able to detect a difference from a normal mouse. And what we did is we can now see that our stem cells have spread out, they've generated all these big networks of cells, but importantly, do they work? All right, because that's the million-dollar question is do they work? And this is data which we're just submitting now, and what we found is that we could rescue these mice. So these are mice that had a pseudo-obstructive picture, they had slow transit through the bowel, and there's a lot of graphs here, I'll just talk you through them, so if I can get the pointer. All right, so this is a normal transit through the gut in these animals, 120 minutes. If you give them this pseudo-obstruction, you end up with a delayed transit. So they actually get distension of the bowel. They actually have symptoms like pseudo-obstruction. If you transplant our green cells, our fluorescent cells in, we now normalize this back to normal. So these mice no longer have pseudo-obstruction. So this is really the first time that we've ever been able to demonstrate that we can take a disease model and actually rescue it. Of course, this is in a mouse, it's not in human, and there's got to be a lot of loopholes, but for the first time at least, there's a glimmer of hope that we're starting to see some treatments which may be effective in the future for children and adults that have quite devastating gut diseases. My time is up. So just to come back to the bus and say that I've only given you a little snapshot of things that are happening. Progress in science is always slow. The bus moves slowly. Qasim's driving it now, so he might move a bit quicker. All right. So, but it's a long journey. It's a kind of the journey of 1,000 mile scenario. And one of the things which I think is critical and why I think we will move ahead, it's a bit like the salmon swimming upstream and who doesn't want to get eaten by the bear. I think if there's enough salmon moving on up, we will get there. And I think that's hopefully what will happen. Thank you very much for your